Hi, YouTubers. Something important, something goddamn important. Today's methods right now. Methods are the big ass cigar right now. Also not Dr. for last damn time. Anyway, discuss based right now essentially head and neck cancer and dry mouth. So, why do they relate? So, basically, this has to do with radiation treatment. Obviously, I'm not a doctor, I'm not a freaking doctor, nor am I a cancer patient, nor am I a cancer survivor. Purely general information. So, take it with a grain of salt. This is purely general information. When you have mouth cancer or throat cancer, it is very common to get radiation treatment, and basically you'll get radiation treatment to your head and neck, and that basically affects your salivary glands. Now, I don't fully understand it. I'm not a freaking doctor, a fucking doctor, basically it affects your salivary glands and makes you produce less saliva. Now, some people, unfortunately, will never get their saliva back, even after treatment, assuming they survive. I mean, this is all assuming you survive the cancer, because there's a lot of people who've had neck cancer who don't survive, who end up succumbing to the cancer. But assuming you are a survivor, assuming you do survive mouth cancer or throat cancer or cancer of the larynx or cancer of the voice box, regardless of any kind of long-lasting things like disfigurement or tracheotomy, that kind of stuff, basically it's very common to have some degree of dry mouth, assuming you've had radiation treatment. This is not so much, as far as I know, for chemotherapy or for surgery, unless you're having surgery on your salivary glands, which salivary gland cancer is a thing. I mean, look at Tony Gwynn. But as far as I know, it's mostly an issue of radiation treatment. The radiation mostly affects your saliva glands, and like I said, some people never get their saliva back even after treatment, even 10, 20 years after treatment, and then there are some people who it takes a number of years, but in general, radiation therapy is very toxic. It's very toxic. It can do quite a bit of damage to your saliva glands, so that's why there are different ways of applying the radiation treatment. There's newer ways, more advanced ways of applying radiation treatment that do less damage, and they are developing new things they're always developing new things with cancer treatment. Compared to 30 years ago, I would say, I can't really give you any false hope, but I would say nowadays your likelihood is probably less of having saliva gland problems than 30 years ago. Obviously, don't quote me on that, but I think things have gotten a little bit better over the years for head and neck cancer patients because there's different types of radiation that can apply as opposed to 30 years ago where it was just really grueling radiation. But obviously don't take that as with a whatever. Take it with a big grain of salt. I mean, take it with a big fucking grain of salt, because I'm not a doctor, I'm not a medical oncologist, I don't have head and neck cancer myself, I'm not going through cancer treatment, I'm not a cancer survivor myself, I'm just purely giving you information I've read online. Purely general information. Anyway, pretty fucking cool. Bye.